Well, I want to talk about baby boomers today and their epidemics that are steaming their way. I mean, these epidemics are coming after them, and I'm not talking about bird flu and swine flu. I'm talking about things like Alzheimer's disease. And just an article came out, and, of course, the experts in Alzheimer's disease saying there is no prevention. Well, that's an absolute lie. It's one of those things, there's no prevention, no cure, no cause, absolute lies. And so this is a very simple physician-caused disease. Alzheimer's disease is caused by the practices of doctors, right? And this actually came out in the first original audio cassette tape, Dead Doctors Don't Lie, in April of 1993. And there's a wonderful article, February 2010, cover article on the U.S. News World Report. It says 7 habits that you can acquire that will help you reduce your risk of Alzheimer's disease. Now, if Alzheimer's disease was genetic, you certainly would not be able to just sleep 2 more hours a night, eat 2 more bananas a week, run around the block 10 times, and do those things you've never done before and reduce your risk of Alzheimer's disease if it was genetic. Okay, so we know just from 4th grade biology that if on the cover article in the the U.S. News World Report, they can say that you can reduce the risk of Alzheimer's disease simply by acquiring these 7 habits. Guess what? It's not genetic. I said that in 1993 in this audio cassette tape because in 1992, UCSD, University of California, San Diego, and the Salk Institute, famous for the Salk polio vaccine, said that just by taking vitamin E, you could actually help people who had chronic Alzheimer's disease. You could actually make them better just with vitamin E. And so I said in my audio cassette tape, got in a lot of trouble because I said Alzheimer's disease cannot be genetic if you can make it better with vitamin E. Okay, there's no genetic disease that will get better if you give somebody a vitamin. All right? So we know those things way back when. Well, here it comes. Just this big article says, you can't. They're looking for the number of Alzheimer's patients to triple because the 80 million baby boomers are coming along, and they're hoping they could hold it down to 18.3 million at any one time that has Alzheimer's disease. Well, that's absolutely insane. I'm only happy with 0. Why would I accept 18.3 million when I know how to prevent it? I can reduce the risk of Alzheimer's disease by 80%. Now, why am I so bold? Because it was a double-blind study by a big, very well-known university. This came out in 2004. It was a front-page article in every newspaper in the land, and everybody's disregarding it. But I've employed all the stuff that they've talked about, and guess what? In some cases, people have been diagnosed with Alzheimer's disease, and they're going downhill in terrible straits after 8 years of being treated like Alzheimer's disease with pharmaceuticals, and they're terminal by the time I get them 8 years later. In 1 week's time, they're totally symptom-free. They're totally symptom-free. Now, I don't believe they had Alzheimer's disease. I believe they had Korsakoff syndrome, which is a deficiency of a single vitamin. But it does look like Alzheimer's disease, and to the naive and the ignorant doctor, they want to diagnose everything as Alzheimer's disease when you have a dementia because that pays more. In the insurance codes, it pays more than vascular dementia, Korsakoff syndrome, and Wernike-Korsakov syndrome. And so they always choose to call it Alzheimer's disease because they get paid more. Now, they're gaming the system. Now, vascular dementia is caused by plugging of the arteries in your brain, just like you get plugging your arteries in your heart. It's the same cause. Inflammation of the arteries in your brain from eating fried foods, processed meats with nitrates and nitrites and oils. And if you're gluten intolerant, you have to give up gluten also. Then there's Korsakoff syndrome, which is a deficiency of a single vitamin. It was discovered by a Japanese naval surgeon back in the 1700s. And Wernike-Korsakov is Korsakoff syndrome, this same vitamin deficiency, but it also has MS, multiple sclerosis, mixed with it. And so you have to give our de-stress capsules and also our selenium to support and promote maintenance repair there. And then if it is Alzheimer's disease, I like to throw in the Smart FX because it has the DHAs and EPAs. And then for, say, a 150-pound to 175-pound person, man or woman, I like them to eat 8 to 12 eggs a day. And people freak out when I say 8 to 12 eggs a day because you have to repair the myelin in the brain, which is what goes away when you have Alzheimer's disease. And the same formula will work for Alzheimer's disease. It works for, of course, it's slower in Alzheimer's disease, but in Wernike-Korsakov's Korsakoff syndrome, vascular dementia, it works very nicely. And then also for Parkinson's disease, MS, and Lou Gehrig's disease, ALS. These are all very similar diseases. They all affect the same tissues in the brain, just more in some areas than others, and so that's why you have distinctive symptoms, because parts of the brain are affected, and by random chance, when you get the other diseases, the same type of free radical damage occurs. So you have to stop the ongoing free radical damage, you have to repair the damage, you have to get rid of the lesions. And so everything we do is to accomplish that. And, of course, we have very, very wonderful results by supporting and promoting maintenance repair of the brain. Drugs to relieve a symptom do not support and promote maintenance repair of the brain. Drugs to get rid of a symptom and just sort of tranquilize people doesn't solve the problem. You have to support and promote maintenance repair. Well, contact your Youngevity associate. If you're a baby boomer, get a hold of that book, God Bless America. Get a hold of the book, Immortality, and learn how to take care of yourself. Doctors just want to get you into their nursing home. They just want to get you in their nursing home. I just want to cry because it's a double standard. We'll be back after these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, this is one of these ones that there are a couple of good reasons to talk about this, but we've heard about all the infections that people get in hospitals, the wrong site surgeries, the mistakes during surgery, the wrong drug, too much of a drug, all these medical mistakes that harm people. Well, we've got a new one here. And the headline of this Fox News story is Sanatizer Oil Static Blamed for Hospital Fire That Burned 11-Year-Old Girl. Say a combination of hand sanitizer, those alcohol-based type, with olive oil and static electricity likely caused an accidental fire that burned a young patient at a Portland hospital. Ireland Lane was using an ethanol alcohol-based hand sanitizer. She used it to clean off her bedside table there in the hospital. She was in the hospital because she had a head injury, and they had done an EEG, so they attached those electrodes to your scalp. Well, apparently, sometimes when they're removing those, in order to help kind of get the glue loose so they don't damage your scalp, they use olive oil. Well, this girl used a whole boatload of this hand sanitizer and wiped off her table, had it all over her hands, wiped it on her shirt, and she had olive oil on her shirt and in her hair from them using it to take these electrodes out. Well, then she decided, as kids will do, she was trying to create static electricity by rubbing her feet on the hospital bed really fast, and the static charge ignited the fumes from the hand sanitizer, and then it burned the girl's olive oil saturated head and cotton shirt. So she ended up with third-degree burns right there in the hospital. And, of course, if she had been using Pure Works as her sanitizer, wouldn't have happened because it doesn't have alcohol.
That's exactly right. And, of course, the alcohol sanitizers only work while they're wet. And I think it's kind of cute. People wave their arms around trying to dry it faster. And, of course, our Pure Works works for hours, 4, 5, 6 hours after it dries, and it will not burn.
There you go. It's a safe product as well. Yep. You don't run a risk of getting, burned alive.
Spontaneous combustion.
Yeah, there you go. This next one, it just shows you where these pharmaceutical companies are coming from. As they're in this country, they're always trying, they were trying to market statin drugs to kids as young as 2 just to expand their market share. Well, I guess they feel like they've expanded to the point where they can't expand any further in the Western world here, because headline of a Reuters news story is drug makers eye Africa's middle classes as next growth market. They say not only economic growth grabbing attention of boardrooms and shifting nature of its diseases and burden alluring Big Pharma, new opportunities open up for treating chronic diseases afflicting middle classes rather than just infections. They say European companies hope to reap rewards investing early in a region many have already had a historic commercial tie to. Sanofi from France, an international drug company with the biggest sales in Africa, is pushing it from current levels of $45 billion. So there you go. That's where they're going to see their next. And we'll need to keep an eye on that, Doc, because I predict that as they expand their market in Africa, the drug-related diseases, like Alzheimer's caused by statin drugs and things, you're going to start seeing a rise in those.
Oh, absolutely. And, of course, in China, I went to China for the first time 25 years ago, and there was no diabetes, just no diabetes. Well, today it's almost like 30% of the population, okay, and that is not blamed on the food. It's just they're not getting all their minerals they used to get. because everybody's moved into the cities and using electricity instead of wood for fuel. It's amazing what modern stuff will do. We'll be back after these messages. Okay, Doug, what pearls of wisdom? Well, we've already done the pearls of wisdom. Let's go to callers.
Yeah, let's head to Alabama and talk to Rick. Rick, you're on with Dr. Wallach.
Alabama. Rick, you're on the air.
Hey, Dr. Wallach, how are you today?
Okay, sir. How can I help you?
Well, I started kind of getting not a necessarily totally dizzy feeling, but something that just wasn't right about 4 months ago. And then I went totally gluten-free, started taking 2 Healthy Start packs a day, the glucogel, the 15 tabs a day, de-stress, 4 selenium 3 times a day. Let's see if I'm missing anything. And the anti-aging, and I even add some cherry mints in with my drink. So other than that, then it's kind of manifesting, and I think I'm getting symptoms of Meniere's. Now, I quit all dairy, and I was really crazy, about ice cream and stuff, but I quit dairy, and, I'm in shape. It's just this thing, pressure in my ear, ringing in my ear, and it's just, it's really bothering me, so I didn't know what you thought.
Yeah, okay, when you have tinnitus, ringing in the ear, and some people get nausea and dizziness, do you ever get nausea along with that?
Not really. I mean, if it kept up and got really bad, I could. It makes me really anxious, and I've had 2 experiences of vertigo.
Okay. Yeah, so it used to be called Meniere's disease, but now it's been renamed Wallach's vertigo. I finally got one named after me, Wallach's vertigo. And basically what it is osteoporosis of the skull. Do you have any dental problems like gingivitis, receding gums, periodontal disease, loose teeth, anything like that?
But I do have a couple of degenerative discs in my neck with herniations.
Okay.
And that kind of stuff.
Okay. So you do have some degenerative stuff going on with your bones and joints and connective tissue in the disc and so on. Yeah, and so this also occurs in your skull. People forget, and doctors themselves forget, that we have 24 bones in our skull and our face, and they get osteoporosis and arthritis and bone spurs and everything that the rest of the bones of your body get. And when you lose minerals out of your bones, they generate a lot of what's called bone matrix. It's kind of a tendon-like material to try and maintain architecture and strength of those bones. And in the case of Wallach's vertigo, used to be called Meniere's disease, and tinnitus, the 8th cranial nerve, 2 different branches of the 8th cranial nerve are being squeezed. The tinnitus is caused by the squeezing of the auditory branch, and the Wallach's vertigo, a.k.a. Meniere's disease, is caused by squeezing of the vestibular branch. Now, hang on, we'll come back. I'll kind of adjust your program for you after these messages. Okay, Doug, let's go right back to Alabama and Rick. Again, how much do you weigh, Rick?
About 220.
Okay, and let's see, at 220, and you're probably doing this all correct, but for our listeners also, I would have you take 2 of the Healthy Bone and Joint Packs, which is essentially the Healthy Start Pack, and the large bottle of glucogel and a bottle of the CM cream. And so I'd have you take 2 of those Healthy Bone and Joint Packs per month, and I want you to take 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner. All that will be accomplished by the 2 Healthy Start Packs per month. And then the glucogel, I want you to take 15 a day, 5 at breakfast, 5 at lunch, 5 at dinner. That will be accomplished by the 2 bottles of 240-count glucogels, and that's to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae in your neck, and bone matrix, bone itself. Then I would also want you to take that CM cream and put a teaspoon down into each ear with a Q-tip, like you're trying to get wax out of the ear. Start when you wake up in the morning, and then 4 hours later do it again, 4 hours later do it again, 4 hours later you do it again. And I've had people that had these symptoms you described for 25 years. They're in their 80s. They've had these symptoms for 25 years, progressively getting worse. And we were at a dinner party, and we gave her some CM cream to put in her ears, and it came back in just 10 minutes, and she's jumping around. I thought, my gosh, why did she do that? She hurt. And she said, no, my tinnitus went away, my dizziness went away. And, of course, I said, well, it's going to come back in 4 or 5 hours. Gradually it'll come back because you just got relief. We've relieved the swelling and and inflammation around the roots of the 8th cranial nerve, and the vestibular branch and the auditory branch, and that's why you got such sudden relief. But we do have to get you on the Healthy Bone and Joint Pack for permanent relief. This is we're going to support and promote maintenance repair of the bones in your skull. We're going to support and promote maintenance and repair in the bones of your skull, and you will get a permanent recovery, and she did. And, of course, we have thousands of people who have really great results every year by doing this little program. So it's just a matter of putting the CM cream in your ear. You're obviously doing all the right stuff. Make sure the dosage is correct. And then call me every 2 weeks and give us a progress report, because you're going to have a great progress report to share with everybody else, okay?
Yes, sir. Okay,
Rick. Thank you so much. All right. Yeah, I love it when people have these problems and we're able to help them with just a little bit of information. And again, these are the sort of things you're going to find in the trilogy of books, Let's Play Doctor, Let's Be Herbal Doctor, and the Passport to Aromatherapy. And these are very simple things. But neurologists like to, put you on cortisone. They tell you have viral infections. You have all these really weird stuff, and they give you antiviral drugs, and they put you on cortisone. And then the side effect of the cortisone, of course, is diabetes. You also get osteoporosis worse because when you take cortisone, and one of the side effects is you get osteoporosis and arthritis and diabetes. And then they've really got something they can work on. Give me 90 days first. Give old Doc 90 days first. Okay, well, stick with us. We're going to be back with more Truth, Justice, and the Longevity Way after these messages.
Let's head to Minnesota. And Charity, you're on with Dr. Wallach.
Hello, Charity. You're on the air.
Hi, Dr. Wallach. How are you?
Fine, thank you. How can I help you?
My dad has myasthenia gravis, and I was speaking with my mom on the phone today, and she told me that his doctor has recommended that he have his thymus gland removed to help the symptoms, I guess. I'm wondering if there's any way that it can be treated using supplements instead of having to undergo surgery.
Oh, absolutely. You do not want to see what will happen is if he gets his thymus glands removed, he won't be able to activate T cells anymore, and he'll lose an enormous piece of his immune system. When you have myasthenia gravis, it's not an autoimmune disease. It's absolutely not an autoimmune disease. It's actually nutritional deficiencies, and, of course, there's another piece to it. Almost always, when you have these types of diseases, whether it's muscular dystrophy, fibromyalgia, lupus, myasthenia gravis, sarcoidosis, it has to do with the inability to repair and maintain and manage your connective tissue. And this, of course, is caused because you can't absorb nutrients, or there's very little nutrients in your food, and there's probably a combination of low nutrients into his food as well as not being able to absorb. And he's your dad. Do you know if he has any history of chronic skin problems, eczema, dermatitis, or psoriasis, or rosacea?
No, nothing like that.
Does he have any history of asthma or chronic bronchitis or respiratory problems, COPD, anything like that?
He does. A couple times a year he gets this chronic cough that just won't go away.
Okay, that's very useful. And do you know, you might not know this being the daughter, but do you know if he has a history of constipation where he needed laxatives or fiber to have regular bowel movements?
I'm not sure about that.
Yeah, you might ask about that. And also another manifestation might be diarrhea. People get irritable bowel syndrome, inflammatory bowel disease. They get things like diverticulitis. They complain about belly pain. It has a gallbladder taken out, appendix taken out. Any of that stuff going on?
No, I do know that he does get, he'll get heartburn sometimes. I'm not sure if that's
some reflux,
related.
heartburn kind of thing. Okay. All right.
Yeah.
And what does he weigh? What does your dad weigh? Is he bigger than you or smaller than you? Let's start there.
He's bigger than me. I'm going to guess he's probably, I want to say, about 220 pounds.
Okay. All right. So here we go. You got to get rid of all the bad stuff out of his life to drive this disease, okay? Do not let him take his thymus gland. Now, that is a no, 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 no. Okay? Don't do it. He'll lose about a third of his immunity by doing that.
Okay.
Okay. Then what I want to do is give up all fried foods, no fried foods, no exceptions, even if it's extra virgin olive oil or coconut oil and extra organically grown vegetables. No fried foods. Then no processed meats with nitrates and nitrites. It means no deli slices, no sandwich meats, no sausage, ham, bacon, bologna, salami, pastrami, pepperoni, jerky, all that kind of stuff, because it inflames blood vessels, inflames muscle and tissue and connective tissue. Absolutely no oils. It means absolutely no margarine, mayonnaise, salad dressings, cooking oils. And if he eats canned fish, it's fine, but they got to be packed in water, mustard, tomato sauce, not oil. No gluten, no wheat, barley, rye, or oats. No gluten, no wheat, barley, rye, or oats. And this is to maximize absorption of the supplements. I want him to have at 220 pounds is 2 of the healthy bone and joint packs. That's going to allow him to have 1 ounce of the Osteo FX Plus at breakfast and dinner, 2 scoops of the Beyond Tangerine Nutri-Crystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and all that will be accomplished by the 2 Healthy Start packs per month. I want him to have 15 glucogel capsules a day, 5 at breakfast, 5 at lunch, 5 at dinner. That'll require 2 of the large 240-count bottles of the glucogel per month to pull that off, and that is to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. Then I would like him to have 9 of our de-stress capsules a day. That's 3 at breakfast, 3 at lunch, 3 at dinner. That's 3 bottles a month of the de-stress capsules, and that is to support healthy metabolism of muscle, nerve endings, and connective tissue, and so forth. And then selenium. I want him to have 9 of our selenium a day, 3 at breakfast, 3 at lunch, 3 at dinner. That is for muscle and nerve health. And then lastly, I want him to have 9 of the Smart FX capsules. These are little pea-sized soft gel capsules that contain DHAs and EPAs. They are the raw materials for your brain and peripheral nerves to make neurotransmitters. And so I want him to have 9 of those a day. That's 3 bottles a month. And you'll know in 90 days if he's going to get a response. And I believe he will, because we deal with sarcoidosis, lupus, fibromyalgia. We deal with myasthenia gravis all the time. And so people do respond quite nicely to these things. And this is because we are going to support and promote maintenance repair of all the tissues involved. And, of course, removing the thymus gland is pretty primitive. That's like when somebody has a disease, let's take a pint of blood out. It's called bloodletting. That goes back thousands of years in the Egyptians, and it came into the 20th century. They still do it in some countries in Europe. But in the 20th century, American doctors were still doing this in the 20s and 30s, where they'd take a pint of blood out, hoping to balance all the fluids in your bodies. Very primitive stuff. Certainly didn't do any good, but that's what they've done for thousands of years. And taking out the thymus gland is something they've done since the 1930s, and they've really caused a lot of havoc and problem with people where they do that. Don't let them do that. Call me every couple of weeks. Give me a update. Okay, Doug, let's go to callers.
Let's head to St. Louis, Missouri, and Mike, you're on with Dr. Wallach.
Mike, you're on the air.
Hello?
Yes, sir, you're on the air.
Yeah, I had blood in my stool, and I was thinking about doing a colonoscopy to checking it out.
Oh, you don't want a colonoscopy to check it out. You want a colonoscopic exam. No, you don't want that. But where I would start, if you know you have blood in your stool, do you have a history of any, like, hemorrhoids, external or internal hemorrhoids?
No.
Did you have your appendix out when you were a kid?
No.
Okay. You ever been diagnosed with diverticulitis? Do you ever have a belly or pelvic pain, had diverticulitis or irritable bowel syndrome, inflammatory bowel disease?
No.
Okay. What I would do then is get a high-resolution ultrasound. I'd start there. No invasion. They're not going to stick anything up your rump. I would go with a high-resolution ultrasound and start there. Don't start out by letting them put a garden hose up your rump and kill you like they did Andy Rooney. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and the 90 for Life Crusade. And Doug, let's go to callers.
Let's head to Southern California. And Tim, you're on with Dr. Wallach.
Is it Tim?
Yep.
Okay.
Southern California, formerly Minneapolis.
Okay. Formerly, so you've moved down there permanent now.
Semi-permanently.
Okay. Welcome to Southern California. How can I help you, sir?
First off, thank you very much for ASAP, Doc. As you know, I've lost 55 pounds, and I'm keeping it off, and what a difference.
Well, how long did it take you to lose that after you started ASAP? How long did it take you to lose that 55 pounds?
92 days.
Isn't that fabulous? We're so proud of you. I know I brag on you wherever I go around the country. And you're, one of my poster boys. You've been with us. How long have you been with us now? 10, 12 years?
No, actually, Doc, since 97, so almost from the beginning. I was 6 months
wow.
from being right there at the beginning.
Well, congratulations. We really appreciate all the grand effort you do and all the great training you're doing. How can I help you today, or you just call in to share your testimony?
No. Actually, I have an acquaintance, 60-year-old male, about 155 pounds, just diagnosed with essential tremors.
Okay. All right. What we want to do is get this guy off all the bad stuff, right? He's got to stay away from caffeine as much as possible. He's got to stay away from sugar as much as possible. No fried foods, no processed meats, and no oils, none of that bad stuff. And if he has any skin lesions or history of respiratory stuff or constipation or diarrhea, any of those kind of things that would sort of indicate he might have a gluten intolerance, then I'd put him on a gluten-free diet. Otherwise, it's not necessary. But at 155 pounds, I'd have him take 2 of the healthy heart and brain packs per month, and be obviously 1 full dose of each of the 4 products at breakfast and 1 full dose of each of the 4 products at dinner time. And then I would throw in the de-stress capsules. I'd have him take 3 of those twice a day. That's 2 bottles a month of the de-stress capsules. And let's see here. I would also throw in what I call Memory FX, because it has some really great substances in there that make the brain happy. And we want to be working on the brain. Also, if he's on statin drugs, I'd have him get off the statin drugs. Also, I would have him eat, at 155 pounds, I'd have him eat 8 to 10 eggs a day, not fried, soft scrambled in butter, or soft poached, or soft boiled with the yolk soft. And we got to give the brain food, which are eggs. And again, if he's on any statin drugs, I'd get him off the statin drugs. And the essential tremors can be, can be managed. And our goal here, by giving him all these nutrients and changing his diet, is to support and promote maintenance and repair of the brain and the physiological functions of the brain. And we really appreciate all the great stuff you've done so much, Tim. Keep up the great work, and give us a call every couple of weeks on this fella, and give us a progress or lack of progress report, and we'll walk through this together. And thank you for being such a great poster boy for the ASAP. It's a great product, and more people are learning about it around the country. And everywhere I go, when I ask in the audience how many of you used ASAP, sometimes as many as a third of the people in the audience, maybe 100 out of 300 people, will raise their hand, and people are really excited about the ASAP, because you get to actually lose weight without exercising. Okay. Yep. Well, thank you so much, Tim. Keep up the great work. Let me hear from you about this fellow every 2 weeks, okay?
Absolutely.
Okay. God bless you. Keep up the great work. Okay, we only have just a moment here. I'm going to go ahead and take it. And again, remind people, if you're one of those 80 million baby boomers out there and you're nervous about dementias, Alzheimer's disease, get a hold of that book, God Bless America, and learn how you can deal with it. I actually have learned how to reduce your risk of Alzheimer's disease, the big guy, by 80%. This is a double-blind study by a big medical school, and nobody's talking about it. And so I chased this down, and this is part of my presentation now. I just can't tell you how much I'm so excited about this, and it's in some of my CDs. So get a hold of the CDs, get a hold of the books, contact your Youngevity associate, get on the 90 for Life program, and let's see if we can't reduce your risk of Alzheimer's disease. Well, thank you, everybody. Really great testimonies today. Great questions. Thank you so much, Doug and Billy. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.